Hello, everyone. Welcome to the HDSA Caregivers Corner webinar series. Today, we're pleased to welcome Drew Yanakis, who will be presenting the third webinar about disability strategies. Drew has over 12 years of experience as a disability advocate and has helped many people with HD successfully apply for disability. In this webinar, Drew will talk about what to do if your claim is denied. Before I invite Drew to begin, I'd like to take a few moments to review how to ask questions as well as how to access this webinar after broadcast. We will answer questions after the presentation. However, you can send a question at any time. To ask a question, just go to the control panel that appears on the right-hand side of your screen. You will see a panel for typing in a question. After you type in the question, just hit the send button. Approximately 1 week after this webinar's broadcast, you will be able to view this webinar again by going to the national website. To access the presentation, all you have to do is go to www.hdsa.org, and you will see a shortcut on our homepage to the webinar. You can also access all of the webinars in the Caregivers Corner series by going to the Living with HD website. And now I am thrilled to turn the presentation over to Drew.
Okay. Hi, everyone. Today we're going to be discussing the strategies for appealing your disability case should you be denied on your initial claim. It's very important to remember that you only have 60 days from the date of your denial to appeal your case. And during that period of time, you will need to be looking at why your case had been declined in the first place. A lot of times people do apply a little bit too soon, or they don't have enough medical documentation to satisfy the disability requirements. And we'll get into some of the strategies to help you and your doctor document your case so that you can get the case through on the appeal. Due to the high volume of cases that Disability Determination Services sees every day, it's unfortunately taking sometimes over 5 months to receive a decision. During this period, keep in mind that a lot of the time your case is sitting is just downtime. And the longer your case takes for a decision does not necessarily mean it's going to be a denial or be an approval. The time frame is really based on first come, first serve. The things that you'll need to have ready when you file the appeal, and you can file the appeal online at www.ssa.gov and follow the link to disability and then appealing the decision. The things that will make your application process easier is if you have complete names and addresses and phone numbers of all your doctors and clinics, and dates of tests that you've had, surgeries, hospitalizations, any type of documentation that you can provide access to Social Security disability determination to acquire. And you'll also need to have a list of all of your medications that you're taking and the descriptions of the side effects you're experiencing. This is a very important part of the disability process, is to really go into detail, if you can, of the side effects that you're having from any of your medications. Even if it's as insignificant as a slight or a very little headache or maybe a little nausea, it all adds up to the big picture when it comes to making the determination. I've seen a lot of cases where people just put none as a standard issue statement for side effects, even though there are some side effects that you could be having. One major side effect from a lot of different medications is fatigue. And fatigue can limit your ability to function in the workplace. If you're not able to sleep at night, if you are so tired that you're nodding off during the day, if your medication affects your ability to drive, all these things are very important to disclose to Social Security so that they can really evaluate the extent of the claimant's illnesses. The appeal consists of a few narratives that you'll be writing. You'll have one narrative, which are the changes in your medical condition from your first initial claim. The second will be new physical or mental limitations. The third, difficulties in ability to care for yourself, difficulties in daily living, and then an update on your medical history. This is a very critical part of the appeals process. Changes in your medical condition are very important because you are looking to overturn the initial decision that was made by a Social Security disability analyst. Keep in mind also that your appeal will be reviewed by an entirely separate team of disability determiners at Social Security, so that you're not going to be going back to the same person who had already made a decision that you did not meet the criteria for disability. The changes in your medical condition don't have to be significant. They could be an increased problem with motor coordination or motor function. It could be a change in your cognitive ability, your memory, etc. And we'll get into if there's no change in your condition from the initial claim in just a few minutes. The new physical and mental limitations section is very important also to go into a lot of detail. Now, mental limitations don't necessarily mean depression. It doesn't necessarily mean dementia or any other type of a psychological problem. It also could mean a change in your cognition, your memory, your ability to complete tasks, anything that is going to be involving your ability to retain information, follow conversations, etc. The more detail you can give in terms of any changes in your physical or mental limitations is critical. In terms of physical, if you are having trouble with fine motor coordination, for instance, where you're having trouble maintaining a grip, if you have trouble holding a pen, if you are having difficulty picking up a cup of coffee or a glass of water, all of these issues are extremely important because they'll help the examiner get you to meeting or equaling a listing under the Social Security Code. If you're having trouble caring for your personal needs, you also want to disclose that, and sometimes that's a very difficult thing for people to do, because you always want to make sure that nobody knows how bad things really are. And it's human nature to try to put up a good, strong front. When it comes to filling out your appeal, showing the decline in your abilities to do certain things is going to make a very big consideration in terms of getting disability. If, for instance, you're not able to cognitively go into a closet and pull out the proper clothes to put on, that's an issue. If you are not able to bend down and you're not able to tie your shoes, that's also an issue. And even though these conditions might not be happening every single day, if they're happening more times than not, or if they're happening periodically within a week or within a month, you should list them. The medical evidence that your doctor has written in the clinic notes and in your hospital notes is the key element that makes or breaks a Social Security case. However, the personal approach that you could give the examiner by explaining what your problems are and how they're affecting your life will then lead them to digging a little bit deeper into your medical record or understanding a little bit more of what they're seeing in your medical records in terms of your reduced functional capacity. Difficulties with daily living is also a very, very important part of the appeals process. Any changes in your ability to care for yourself, to cook or clean or shop or clean your house, do your laundry, etc. These are very important things because they will decrease your functional capacity, which will then give Social Security the opportunity to say, well, if you are not capable of doing basic activities, then you would not be expected to be able to do any type of work activity. One other footnote right here is when you're looking at Social Security disability benefits, you must remember that you are not being evaluated based on whether or not you're able to do the job that you are presently doing or have just left. They will evaluate whether or not you're able to do any type of job anywhere in the national economy. And if they find that you are capable of doing some type of even sedentary work, then you would be found not disabled. So the more information and the more detail that you put into your case, the better chance you're going to have of getting a positive outcome. The detailing your conditions are very personal to you, and you want to personalize your application as much as you can. You can put as many extra pieces of paper with information on it that you want with your application so that you can very, very cohesively describe everything that is going on with you. Take your time in explaining the changes in your condition. Since you've already now been denied once, you have to now show that whatever was happening on your initial claim in your ability to function in your daily activities and in the workplace has changed to the point that it is obvious that you are no longer able to do it or you never were able to do it. Therefore, explaining more about the changes in your condition and how your condition affects you is very important, and even tie it into the initial claim. You can refer to your initial claim and say, I feel like, you're downplaying this portion of my illness, and this is how it's affecting me now, this is how it affected me then. One other thing before we move on is a lot of people, when they file their appeal online, they think that's it. Once you push the send button, you're almost done. But it's also very important that you print out the medical release form number 827, fill it out and sign it, and send it into your local Social Security office. Your case will not be processed to Disability Determination Services without the release form. Elaborate on all of your physical and mental changes if you feel that there's really not been any change in your condition since your initial application, but you do feel that you are still disabled and unable to work. A lot of times, if the initial application was done speedily, or if it did not go into enough detail, or if there was not enough medical evidence at that time, it's important to elaborate on all of the negative changes in your condition. It's also very important to talk with your doctor at this point about your condition and make sure that the medical records that your doctor is keeping up with all of the changes in your condition. If the medical documentation does not support what you are saying as what your condition is right now, then unfortunately Social Security is going to have to weigh heavily on the medical evidence and not as heavily on what you're saying. Talking with your doctor and making sure that your doctor is aware of all the changes, even the small ones, something that you might even think is inconsequential, is very important to have in the medical record. And then when you're filing your appeal, you want to elaborate on what is in your medical record and what is in your possible psychiatric record or in your record that you're developing with your doctor about your emotional and your cognitive changes. If the medical evidence is not strong, then it makes it very difficult for Social Security to make a determination. However, if in your narratives as you're writing your appeal, you bring up some serious issues of your declining functional capacity, that could very easily prompt Social Security to send you to one of their doctors, which of course they will pay for, to have an independent evaluation based on your present condition. This is a tool that Social Security uses to, for no better use of a catchphrase, to dot the I's and cross the T's. If your doctor is minimizing or has minimized your clinic notes or is not creating a thorough evaluation of your condition, Social Security can go in and ask for an independent doctor to take a look at you for both your mental condition and or your physical. The other thing that when you're working on your appeal, make sure that you redevelop the changes in your functional capacity. If nothing has changed and you're still functioning pretty well, the odds are that the initial claim will be upheld and your appeal will be denied. This is why I tell people that it's very important to not apply too soon and make sure that there is enough medical evidence available to support your claim. Once again, the best way to support your claim is to have a good, long, thorough evaluation done by your treating neurologist and or PT and OT, physical therapy and occupational therapy, to really discuss the changes in your condition and the changes in your functional capacity. Once again, while your disability appeal is in process, you will receive the same questionnaires that you filled out on your initial claim. And if you would like to refer back to the second webinar for Disability Strategies 2, we do have the questionnaires online there for your review. The one thing to consider when you complete these questionnaires again is to keep in mind what was said in the original questionnaires, and you want to elaborate on them. And in the appeals process, when you're doing your online application, and you're going through the 5 different areas where you're writing up your summaries of your changes in your condition, etc., you want to include some of those words into your questionnaires. And you want to make sure that you are very thoroughly answering the questionnaires in a fashion that will depict not necessarily your worst day every day, but your worst day on most days. It's very important to not explain your limitations and the problems that you're having, even the small ones. The one other thing that's very, very important when you are filling out your questionnaires is to be consistent. And there are sections in the questionnaires that refer back and forth to each other. And there's more information concerning those questionnaires on the second strategies of disability on the webinar. The consistency in your answers really makes a difference in terms of how Social Security is going to evaluate your answers and how they interact and how they apply to your medical record. It's really, really important that your doctor be documenting a lot of the same information that the questionnaires are asking. Your daily living and your daily function and your functionability is going to be the only way to get your case through. And if you are totally capable of taking care of your personal needs and your daily activities, etc., then they will find that you're not disabled. But if that's not the case, then the only way they're going to know exactly how bad things are is if you write it down. The questionnaires, even though they're going to be or appear to be duplicate, they're really not, because a couple months has gone by since the time of your last questionnaire. What's a very difficult thing, but it's also a very important thing to do, is really think back to when you filled out the first ones, and before you start filling them out, evaluate exactly where you are now compared to where you were then. Even the slightest change could make all of the difference in the world in terms of meeting or equaling a listing. When you are doing your appeal, you want to really make sure that every single aspect of your life is discussed in it, even if you need to add more pages. This is your last chance for Social Security benefits before the long wait to go to the administrative law judge. Should your appeal be denied, unfortunately your next step is to go to the administrative law judge, and right now that process is taking anywhere between a year and a half and a year and 3/4 before you would even get a date for the judge. So the moral to that story is the more information you put into your appeal and the more time you spend working on explaining all of the changes that are occurring in your life, the better chance you're going to have of a successful appeal. The documentation from your doctors is critical. If you are seeing a neurologist once every 6 months, once a year, you might want to try to get into the neurologist and update your medical history before you file your appeal. Social Security will have all of your records and will be reevaluating all of your medical records that are in your initial claim. So as you are proceeding to the appeals process, you want to make sure that there is something new or there is something more to add to your claim that could help push you up and over to a successful appeal. The documentation from your physical therapists, if you are having motor function problems, is extremely important. And one thing that Social Security looks at very critically is the amount of weight that you're able to lift, if you're able to push or pull, how far you're able to walk, and what pace you're able to walk. These evaluations are very important to help Social Security meet or equal one of the listings for Huntington's disease. And under the motor function section of 11.04b, there's a lot of different parameters that are set forth that your medical record has to show and prove that your capabilities are within their parameters. The more information that you can get your doctor to disclose, the better. If you are in between appointments when you're filing your appeal, because you only have 60 days, and if you feel that there has not been a significant change in your condition from your initial claim to the date that you're filling out your appeal, you do have the ability to not pursue the appeal, and shortly down the road, or 6 months down the road or a year down the road, if things start getting significantly worse, you can always reapply and do a new initial claim. The unfortunate part of going for a new initial claim is your onset date for benefits. Social Security will only pay a benefit back 1 year from the date of your application. So if your onset date for disability is set a year before your initial claim and you do not continue the appeals process, you might lose some of the back benefits. You might get the same onset date, but you would not be able to obtain the financial aspect of the process if you are now a year ahead. A lot of times also Social Security is able to reopen an old claim if your condition warrants it, and possibly revisit that even if you have not appealed. So there's a lot of information to juggle as to when to start the initial process and whether or not to continue into the appeal. The appeal itself is a important tool in terms of trying to get your initial claim overturned, because you will be getting a different person reviewing the claim and you're going to be having a different perspective, plus more time has gone on. This is why when you're filling out the appeal paperwork, you want to make sure that you really elaborate on all of the changes in your condition. The questionnaires, like I said, are on the website for hdsa.org, and you can follow the link to the Caregiver's Corner and click on the disability strategies. If you haven't been on that site before, I'll take you through right now real quickly. This is the main page for the HDSA website. On the far right-hand corner, you can see here at the bottom is Caregiver's Corner. And if you click there, it will take you to the next page, and over on the left, you'll see the Caregiver's Corner webinars all listed right here down the side. The information that is in here is very important to get your case through. There's also a lot of other forms and a lot of other reports and documentation that can assist your claim. And you can feel free to either contact me or your appointed representative to help you with this. I'll give you some examples, and especially in an appeal, the more documentation and the more information that can come from a doctor or from a physical therapist or an occupational therapist or from a psychologist, the better. If you're having cognitive problems and if you're having trouble with memory and whatnot, a neuropsychological test is a very important tool that Social Security weighs very heavily when they do an evaluation for the chronic brain syndrome category of Huntington's disease, which is 12.02 under the Social Security Disability Determination Blue Book. The neuropsychological really ties together a lot of your neurological changes as well as your cognitive changes. And even though you might have an advanced degree, you might have had a very high-performing job, if your neuropsychological evaluation comes back showing deficits in executive functioning, in other impairments within the report, that weighs very heavily with Social Security in terms of meeting or equaling that listing. Once again, your PT and OT notes are also extremely important because that would help with meeting the motor function report. Summarizing again, your appeal is unfortunately timed, and you only have 60 days from the date that you were declined. And it's very important, once again, to go over the changes and the new mental and physical limitations in a lot of detail. The more detail you can give, the more detail your doctor can give, the more detail your PT/OT can give, the better chance you're going to have for meeting or equaling a listing. Unfortunately, just having a diagnosis of HD does not in and of itself grant you disability. However, having an exacerbation of the changes in your motor function and your cognition and your chronic brain syndrome functions are what will make or break your case. The changes in your daily activities, the changes in your personal needs, unfortunately it's probably the hardest thing you'll ever sit down and write out and try to quantify in writing how bad things are or how good things are. It's very important that you be as honest and as in detail as you possibly can be. One other thing that I do with my clients is I try to bring in a caregiver when we're filling out these forms and bring in a second party that is aware of the patient's condition and could also add a little to the mix when it comes to showing all of the changes in the daily activity and the personal needs. Sometimes the patient is not even aware of some of the deficits that they might be happening or that might be happening, and having a third party involved in filling these reports out, filling out the appeal application, filling out the questionnaires is very, very helpful. And it also would give the examiner a better viewpoint from both perspectives. A perspective of somebody that is helping you with some of your daily needs or your personal needs, or also their observation of what's happening with you cognitively and or emotionally. The evaluations for the cognition and the mental changes and your ability to function in a normal daily living environment is crucial to your claim. Generalities like "I'm fine," and I read a lot of medical records where the doctor writes down that the claimant, came in very well dressed, looks great, feels great, and everything is, moving along smoothly, and that's the end of the report. That's where you need to spend a little time with your doctor and explain how things are actually changing. If you are having trouble picking out different clothes, if you're having trouble buttoning your buttons, if you're getting assistance from a loved one or a caretaker to keep yourself going and looking strong and looking good, that's great, but you need to let the doctor know, and you need to show what type and what conditions you are receiving assistance with and how often you're getting assistance for them. The elaboration on everything that was put into your initial claim is crucial. If you feel that based on the denial that the examiner was not evaluating your condition 100%, you can go back into the initial claim and say, this is what was happening. I don't understand why they would think I could still do sedentary work or something to that extent. One other key is if you do have an appointed representative or an attorney, it's very important for them to get a copy of your Social Security records so that you have a very good idea of exactly how the decision was made and how close to an approval you actually were, even though they might not have approved your claim. When you're filing your appeal, it is not a hard process. It's a lengthy process, but it is something you can still do on your own or with a caregiver, or if you want the edge of having somebody that is more familiar with the forms and with the criteria involving an approval for disability, contacting HDSA for a list of representatives, or talking to your neurologist in your area, or contacting me. I'll be more than happy to give out any type of advice or any type of assistance I possibly can. The process, like I said, is a lengthy one, and it is often sometimes confusing, but it's also a very important tool, and it's something that if you are feeling that you are not capable of working, that you do continue to pursue your applications all the way through. Being turned down on your initial claim does not necessarily mean that you are not disabled. It could be very easily explained that there is just not enough medical evidence, there is not enough decline in your functional capacity, but within the next couple months there could be. HD patients change very quickly, and possibly the initial claim might have been minimalized just a little, and by elaborating on everything from day one with your HD diagnosis to the day you file your appeal is the key and most crucial point in applying for Social Security benefits. Keep in mind that the medical evidence has to support what you are writing in your appeal and what you're writing in your questionnaires. And sometimes the questionnaires are a very good tool to take them into your doctor with you and say, these are the kind of questions that they're asking, and these are the kind of information that I need to have in my medical record. And that back and forth education has been very helpful to a lot of the patients that I've helped with HD get Social Security benefits on the initial and or on the appeal. One other thing is that I have been noticing over the last couple months, I've had quite a few people questioning, do I need to have a genetic test done, and do I need to have proof positive that I do have HD? That answer is yes and no. If you don't have a diagnosis of HD, you still can meet or equal the listings for 11.04b, which is motor function, and chronic brain syndrome, which is 12.02. However, you're going to be meeting those two listings without a neurological backup and without a neurological disability to explain why you're having them. And what I have seen and what I've helped people with claims that I've done with Huntington's patients is I've seen their initial claims being denied because they don't meet the criteria for no other reason than just not being able to function with their motor coordination or their cognition. But when you add in a definitive diagnosis of HD, which shows a neurological disorder that is progressive, it sometimes pushes the case over to an allowance because now you've got more medical documentation to develop your case. So the actual testing is important to the case. It will not make your case 100%, and having a diagnosis of HD will not in and of itself grant you disability. However, it is a very, 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 very strong compensating factor to the reasons why you are having motor problems and cognition problems and coordination problems, etc. And that compensating factor, because it is a progressive illness, and once it's diagnosed, will let the examiner know that your inability to do fine manipulation or bend or walk or your chorea movement or your cognition is not going to get better. It might plateau, but it will never get better. And that's a component that makes a really big decision when it comes to getting an allowance from Social Security. There again, I'll go back to what I always say, don't apply too soon, and it's what is in your medical record that will make or break your Social Security case. Every single piece of documentation will add up to a decrease in your functional capacity and your ability to function in the workplace. And unfortunately, not like with short-term and long-term disability from an insurance company through your employer, Social Security is evaluating your ability to be able to do any type of work in the national economy at any level. So if you are capable of doing a sedentary job, if you're capable of doing a repetitive task, for instance, they are going to evaluate that you are not disabled because you're capable of doing that. Therefore, when you're in the appeals process and or in the initial claim process, it's very important to keep that in mind and explain your limitations fully. Another major limitation that a lot of people miss, and I popped into my head, is being able to be in an environment with loud noises, heat, smells, chemicals, etc. If you are capable of doing some type of a repetitive task because your cognition and your motor capabilities will allow it, but you're not able to go back to your original work, if you are not able to be in an environment where you are around a lot of people, that you can be exposed to changing temperatures, etc. This is another part of your disease and part of your medical record that needs to be documented, because that could put you to the point where you are no longer capable of sedentary work or repetitive work or possibly factory work or something like that on an assembly line because of some of your symptoms. So the more you can write down, the more you can cohesively put into your appeal report, and the more you can put into your questionnaires, and the more that is in your medical record, the better your chances for a successful disability determination. And I just got a note that we should start taking questions. So if there's any questions, we can break here and I can answer them, or if there are no questions, I'll just keep talking.
Thank you, Drew. As a reminder, to ask a question, just type it into the question panel that appears on the right-hand side of the screen and hit send.
Okay, now bear with me while here we go. Okay, this is a unfortunate question that a lot of people are faced with. The question is, how do I get my mom approved for help? She could not get SSI or SSDI because she didn't have enough credits, and that her SSI was denied because her dad has too much asset, but she does need 24-hour care. This is a very difficult situation because if you have not paid into the Social Security system and you are not what is called, quote-unquote, insured for Social Security disability, your only other option is SSI. SSI is Supplemental Security Income, and it is a program that is based on income and asset. And being married, assets, of course, are communal. And if dad has or the spouse has money in the bank, if you have excess property, excess resource, etc. You would not be eligible for SSI. And getting 24/7 care is difficult for anyone, be them in a nursing home, be them in their own home or whatnot. It's a very difficult situation. I take it from, and I'm just reading between the lines, that Dad must still be working and Mom is not 65, therefore she's not eligible for Medicare. And unfortunately, even with a determination from the Department of Medical Assistance for disability, since she's not eligible for Social Security benefits, the 401k would, and his income would be considered even for Medicaid care. And under Medicaid rules, your income can be spent down in most states in the country, not all. However, your 401k would be a financial asset that you could not overcome. Getting even into a personal care waiver or getting any type of personal care through social services, it's still going to be income generated. It's going to be, your assets will be evaluated. And unfortunately, if their medical insurance does not assist with long-term care and or personal care needs, there isn't a whole lot that can be done. In certain areas of the country, and I know in certain areas, in certain counties, unfortunately, here in Virginia where I am, hospice offers transitional care and some respite care. There again, there are financial criteria that have to be met, and their specific needs have to be met, but nothing ventured, nothing gained. It might be an idea to contact your local hospice and see whether or not they offer any type of services. Unfortunately, other than that, there's not a whole lot that I can elaborate on past there. Unfortunately, on Saturday we did a symposium here in Virginia, at the University of Virginia, and that exact question came up, and I know that it is a very critical problem when someone does need extended care, and financially there's no way of doing it. The one other thing you might want to look into is if the care is excessive, you might want to look into nursing home and see what criteria you might be able to meet within that. So I wish I could have given you better news, but that's about as far as you can go on that one. Now, in the event that the 401k gets paid down and the spouse's income drops or goes away, then you would possibly be eligible for SSI, and with SSI you would be eligible for Medicaid. However, Medicaid still will not provide 24/7 care unless you're in an assisted living facility. And depending on household income would be depending on whether or not the Medicaid application would be approved.
Thank you so much, Drew. We have about 8 more minutes if anyone has any additional questions.
Okay, while we're waiting for another question, one other thing that I wanted to bring up is when you are doing your application for the appeal, it's very important to make sure that you've got complete names and addresses for all of your doctors, clinicians, therapists, physical therapy, hospitals, etc. One thing that really delays a case in the development center is trying to locate addresses and whatnot, and with the volume that Social Security is having right now, the more information that you can provide, actually the quicker you'll be able to get a decision. Keep also one thing else in mind, that you will never ever be required to purchase or obtain your own medical records on your own. Social Security will do that for you. And I've seen people go out and spend quite a bit of money trying to get copies of their medical records. Rest assured that Social Security does take care of that and actually can get the records a lot quicker than you possibly could. Another question we have is, have a brother-in-law ready for nursing home, however having problems with no nursing home willing to take him. Any suggestions? Yes. One major suggestion I have is to get in touch with your local ombudsman. Your ombudsman is a person that will advocate for people's rights in nursing homes and rights to get into a nursing home and to be able to stay in a nursing home. Unfortunately, the nursing homes do have the right of first refusal. And they probably would never say that the reason that they will not take your brother-in-law is because of Huntington's or because of this, that, or the other thing. There's a lot of ways that they can deny access. However, I would suggest getting in touch with your local ombudsman and talk with them about some type of assistance in getting your brother-in-law into a nursing home. Here in Virginia, our ombudsmen are usually hooked up with the Board of Aging, even though you don't have to be aged in order to obtain help from an ombudsman. But you can go online. There are listings for your local ombudsman. Actually, I think it's ombudsman.org on the internet, and they should be able to help you locate a place for him. Another strategy is if your brother-in-law is in need of medical treatment, and if he winds up in the hospital for more than 3 days, the hospital will help assist in obtaining a nursing home for him to go to if he's not capable of returning home. One problem that I would want to explain is that if you are in a hospital environment and they are going to discharge to a nursing home, they will discharge him to a nursing home first bed available. So it might not be convenient, it might not be a nursing home that is on your first choice, but that's an option. Another thing you might want to do if he is at home, contact your local Department of Social Services and ask to speak to an adult service worker on coverage. An adult protective service worker possibly would know of nursing homes in your area that might consider taking him.
Hi, Drew.
Yes?
The other thing that anyone who is having trouble with finding a nursing home for their loved one can do is to contact their nearest HDSA social worker, which they can find by going to the HDSA website, www.hdsa.org. Our social workers will work with families to both educate the nursing home as well as to find an appropriate placement.
I should have known that. Thank you, Jane. That's wonderful. And you can go on the same website that I showed you a few moments ago, and you can locate those names. Another question is, I'm a 55-year-old self-employed attorney. My cognitive abilities decreased, and I'm concerned how much longer I'll be able to properly represent my clients. I've had genetic testing and have 39 repeats. Did you say that if a person can do any job, they can't get disability? Yes and no. What I said was that if you are capable of doing some type of sedentary work, that you would possibly be denied because they deem that you are capable of doing some type of work in the national economy. However, there are a lot of factors, and that was a very, very general statement that I don't want anybody to get concerned about. There are a lot of compensating factors that enter into somebody getting Social Security benefits. Age is one, the type of work you do is another, and what your decline in cognitive abilities are actually showing up on testing. What I would suggest for you, even as an attorney, I would suggest getting neurocognitive testing, and if your cognitive abilities are declining to a degree that you are not capable of continuing to work in any profession, then yes, you would be deemed disabled. Now, one thing to also consider is if you are of advanced age, and with Social Security they consider people 55 and above advanced age, they're going to look at you just a little bit differently than they would if you were 30, and they would be looking at your ability to retrain into the workforce, what type of work history you have that can be retrained into another field. So as you're getting older, it gets a little bit easier because you're not going to be able to retrain as easily into another field. However, no matter what your past job was, if your cognition is severely challenged, and if you are having other HD symptoms and you can show a major decline, then yes, you could be declared disabled by Social Security. This was not a finite, definite, if you can do, a sedentary job that you would be denied disability. It's an accumulation and a compilation of all of your conditions all put together and evaluated based on your age, based on your education, based on a lot of different factors. So if you have any other questions, you could feel free to email me or call me. I'd be more than happy to talk to you. Cognitive decline and a neuropsychological showing definite deficits in your cognitive ability and a change in your cognition over short periods of time would then lead disability to say, well, we've got a progressive thing going here, and this is not going to change. So I would need a lot more information to push this a little bit farther, but no, it's not just a total rule of thumb.
Thank you so much, Drew. So we are at 1 p.m., so that concludes this webinar. Please don't hesitate to contact Drew. His contact information is up there for your individual questions.
Jane, one quick thing, this last question that just came up, if Dave would like to email me or call me, I'd be more than happy to go over the situation with him.
Thank you so much, Drew. And as a reminder, this webinar will be available for view in about a week on the HDSA website.